So at this point, we're injecting tumescent fluid into the areas where we're doing the liposuction. And the tumescent technique is used because it minimizes the amount of blood loss. And additionally, it decreases the risks of lipo, because most of the risks of lipo are associated with if there is significant blood loss. So we want to inject at least 3 times as much fluid as the amount of fat that we're going to remove. And as you can see, I'm injecting it into all the different layers, so the epinephrine, or the adrenaline in this tumescent fluid, is able to act everywhere. Once it's injected, then we wait about 10 minutes to make sure that the epinephrine has enough time to act. Then we go about starting a liposuction. So this is the safest technique we have right now. It's called the tumescent technique. And it works very well. Well, I used something called a Becker cannula. Can you show me the Becker cannula? So I use this cannula with the open tip to separate the fat. And then, after that's done, then I use this cannula to suction the fat. And as you can see right now, we have very little blood. Okay, mostly yellow fat that comes out. And this area is very important. As you can see, it's a little triangle right above the buttocks, and there's no fat. And you can see it's nice and even. What this gives you is the nice sweep right above the buttock, improving the entire look of the back. So after we do this, the next step is to work on the flanks. This is to give the narrow waist. I've already used the Becker cannula, which is the cannula with the tips that are open. And as you can see, look at that. Just yellow fat. The tumescent technique. And in addition to the tumescent technique, we also use the Becker cannula to further decrease the blood loss and decrease the risk of contour abnormalities. Okay. Can you show that? Nice and clear. There's no minimum blood loss. The liposuction with a patient in the lateral position gives you the best chance of getting as narrow a waist as possible. As you see, these are the markings. This is the line above the lowermost ribs. So once we're done with the liposuction, you'll notice that the waist, which is already better than it was, is going to get very, very narrow. Liposuction the waist from the back and the front. So you can see the back contours have already been obtained with the liposuction with her on her tummy, but very soon you'll see the significant improvement that you'll get with liposuction coming from the anterior aspect as well. Tumescent anesthesia, how this fluid that comes out is almost all fat and very little blood. Color's yellow. It gets much better than that. Stop. You see now I have suctioned the fat, and you can see the significant improvement in the waist contours. And now I'm using the same cannula that I used initially to separate the fat to minimize the risk of contour deformity. You see that? And there's nothing but skin here. No fat left, right down to the ribs. And this really optimizes the waist contour. We are now working on the abdominoplasty portion. We've already done liposuction of the back and flanks. And one important thing about the tummy tuck is to make sure that the incisions are made low enough. I make it low enough such that it will just about always be hidden by the envelope. Make the incision low, and you want to continue the dissection, leaving just a little bit of tissue on top of the fascia, as it helps a lot with pain. One other procedure that I add for my tummy tucks is I put in something called a tap block. So this is an injection of local anesthetic that's long lasting to the nerves that supply this area, and it helps a lot with controlling pain after surgery. And as I mentioned earlier, for my tummy tucks, I inject a tap block under direct visualization. So here I'm dissecting down to the appropriate plane until I visualize it. And once I find it, I have a blunt needle that I then inject a tap block. Let me show you. One side. We see the rectus diastasis. It's pretty clear. You can notice there's the edge of one muscle and there's the edge of the other muscle, and the connection has been thinned out quite a bit. So we're going to correct it with interrupted sutures that are permanent, starting here where the ribs start, going all the way down to the top of the pelvis. So here, you can see that the muscle has been brought together, and you can see how the abdominal contours have improved significantly. Just tightening the muscles in the midline flattens the abdomen significantly. Okay? I'm going to dissect a little bit more of the soft tissue of the fascia. Okay, as you can see now, the Y-shaped incision I have made for the umbilicus results in a very pleasing umbilical scar, which will be hidden, and it improves the contour of the whole belly.